Okay. All right. Well, let's get started. Um, we are thrilled today to have Jason Simon Ressler from the Department of Health. He's going to go over some Title V work with the Maternal Child Health Block Grant and Food Sufficiency. But just before we get going, just a quick reminder, this webinar is hopefully one and the first in a series with the South Dakota Healthy Nutrition Collaborative. Specifically, just a reminder, the purpose of the collaborative is it brings a collective voice to support access to nutritious food, which brings a strong foundation for healthy South Dakota families and communities to prosper. There are 3 goal groups of the collaborative, and they're listed here. The one where this opportunity falls under is the first one, to improve coordination, identify areas of statewide research, evaluation, and promote programmatic best practices to improve South Dakotans' food and nutrition insecurity. So with that, I am going to go ahead and let Jason go ahead and share his slides, and welcome, Jason.
Awesome. Oop. Get here. All right. Can you hear me?
Yes.
Okay, I'll turn off closed captions if that's all right. I think the Zoom will have them anyways. So, my name is Jason Simon Ressler. I work over at the Department of Health for here in South Dakota. Here I'm going to talk a little bit about the Maternal Child Health Program's new priority selection of food sufficiency and what it means in the context of South Dakota. Most people are familiar with what the public health methods, but if not, this gives a little bit of an overview, some of the functions of public health, and in the context of what we're doing, it's all about the interdisciplinary and multi-sector approach that we can take to support South Dakota in our vision of having every South Dakotan be healthy and strong. And so that's a little bit of context if you need framing out the public health methods that we use. And now to talk a little bit about Title V. So this is a funding stream established in 1935. It's been around for quite a while. We are supported by the Title V Maternal Child Health Services Block Grant over at the Department of Health. So we're one of many within the larger Department of Health. And so we use a performance measure framework within our block grant to kind of assess where things are, where we're going, and how we can enact change to support different initiatives relative to the maternal child health population. So within that, we have national outcome measures. The one I'll really be touching on today is national performance measures, which kind of sets the tone for what we're going to be working on specifically as a priority. Then we have evidence-based strategy measures and state performance measures, really just going to focus on those NPMs today. So within our maternal child health, we have 5 domains that we consider. Now, the ages can vary and it can get a little confusing sometimes as different metrics have different age range variables. And so we have the women maternal health domain, the infant perinatal health domain, child health, children, youth with special health care needs, which we pronounce as SHIN, and then adolescent health. And then under that, we also have another domain, which is cross-cutting and systems building. But today we'll focus primarily on child health. So, oops. Oh, yep. Okay. So here are all of the national performance measures that one can select, or a program within a state can select. There are quite a few, as you can see, so it can be really difficult, but usually states only pick about 1 or 2 per domain. And so we went ahead and did a needs assessment. I could touch more on the needs assessment later. But within that, we identified some in South Dakota as the most emergent priorities that we would like to work on based on a lot of input from the communities and partners. But within the child domain, as you can see in the middle of the screen, food sufficiency did emerge as one priority that we would like to address along with our partners. So you can also see medical home as another one. I will also be working on medical home. If there are any questions or inquiries about that, you can definitely throw those my way. But I can provide more context too at the end of the presentation here. So why focus on food sufficiency? So as I mentioned, we did a whole needs assessment, and technically we're still in our needs assessment, which is always an ongoing process. And so within that, this past spring, we did 5 community conversations, 3 different partner meetings. We attended 6 outreach events, and we promoted a survey that helped us identify some of these priorities among all populations. Anybody could have filled out that survey, and we gathered input from all over the state. So one thing I'd like to touch on too, and a little bit more on the why I focus on food sufficiency, we do take a life course perspective on a lot of what we're talking through in why are we doing this kind of thing. So when we put food sufficiency into the context of the life course perspective, which is really just the notion that throughout a life, there's a certain critical periods that you'd like to touch on more, because that can have a compounding effect with all of the other things that influence a health trajectory over a person's lifetime. So we do take that into account when we're considering some of these priorities and what we could have impact with. But we generally do like to take a life course perspective on the different initiatives that we like to engage with. And so food sufficiency fits right in there. And it's very important that we consider some of the things in these first 11 years of life, as you'll see, as this metric is looking at in food sufficiency for kind of the national perspective. So the needs assessment process, a little more digging into that. So the top priority was actually access to childcare in our state in our needs assessment. That doesn't mean there's other top priorities and consensus elsewhere, but it was access to childcare and food insecurity. Now, traditionally, Title V hasn't had a huge role in supporting childcare, but we can always support parenting education, things like that, and there are things that we can do to support that. But food insecurity, or as the measure calls it, food sufficiency, which is kind of a spin. It's kind of looking upward on the issue of food insecurity instead of downward. And so we decided that was, as the second top priority in child and one that we felt we could have impact on and support partners in, we did decide to go with food insecurity or food sufficiency. Then there's all kinds of other issues. A report will be coming out later in 2025 on all of these issues as it relates to each of the domains within maternal child health. So we did dig into the data a little bit more. We have, a little bit of data from Map the Meal Gap here that kind of started to, frame out where are we gonna start to consider, but also let's take a statewide scope, which I know the South Dakota Healthy Nutrition Collaborative is also looking to do, is to get some more of that landscape analysis done and then have that support any other initiatives going on in food sufficiency. So again, food sufficiency as a national performance measure. This really just means that we're going to look to aim to increase the percentage of children ages 0 through 11 whose households were food sufficient in the past year, which might be a spin. Some people are used to food insufficient, but we are looking to, get that bar up from an upward perspective. And so that doesn't mean that we aren't looking at the critical areas of food insufficiency or food insecurity in our state. That just means, again, just how we frame it out is a little bit different. But and how we'll do that, we'll use strategies to create an action plan based on evidence and partner input. So that is currently kind of where we're at. We're looking at these strategies, and we're going to go within our role of identifying those strategies to support that. So some of the things that we can do, we can help assess, collect and analyze some state level data on that food sufficiency. We can help plan, which involves those strategies, as I mentioned earlier. And then we also have some funding. It'll be here and there as far as we're still figuring out where we're gonna support funding with, but it will primarily be within, focus on child, to support some of those initiatives. And then we can always track progress and adapt interventions, which is some of the core functions of Title V programs in general. So here are some example strategies. So we wouldn't go with all of these because we're looking to really identify 3 top that we can start to address in this first year, which I have not mentioned. It is a 5-year commitment when we select a priority or a performance measure. So we're going to be working on this for 5 years, working with partners, using that process I mentioned earlier to collaborate over things and support where we see it necessary. And so um, of these strategies, there's we do use evidence-informed strategies. We try to have that be our starting point. And so, we had these start to emerge within a recent meeting in the child domain. I'm sorry if any of you didn't get that invite, but we are looking to support So far, we need to kind of look at these and still consider partners and examples and things like that of how this might play out. Because although these are strategies, we can broaden them or be more specific. But within the strategies, we have actions that we'd like to take to support food sufficiency. And so these are some that have emerged, which are, maybe some state capacity building, different partners here and there. We could have nutrition education as an emerging priority, evidence-based, and something that I think is also achievable in our state. We can support some nutrition education programs which is also needed, as I've worked with partners to understand, and social marketing and public awareness campaigns. And then this last one, which is in itself another strategy. So we could look at access specifically to nutritious foods and get a little bit more into the weeds on, the availability of fruits and vegetables and what's coming out of that. And so all four of these strategies are on the table. I am going to send out an email to those who have engaged with the child meeting. And if anybody in this group would like, I'd also send it out to you. There's not any, there's both not an incentive financially to be a part of the group as terms of like talking through these things, but we do hope that people's, their goals and missions align to kind of support some of these strategies, or at least help identify where could we go and support with and work with partners to take action. So we can talk on those a little bit if we need. So the next steps for us, we're gonna be engaging with partners. We're gonna complete this action plan in the spring, but we won't be technically implementing it until October 1st of 2025. So this action plan that I mentioned, it'll take those strategies and make actions under them, and figure out how we're going to measure these things and all kinds of things like that. So um, we love input on that, on how we can continue to support the action plan. We are kind of leaning towards those strategies I mentioned in the previous slide, but any input is great. We'd love to get some more context on how we can execute some of these, and so and have a partner. So if you would like, I'd also really like to plug our MCH team. We do a lot of great work. We're currently going through some great website updates. We're trying to make our website better, more something we can engage with partners more. So on the left there's that website QR code, or you can go to doh.sd.gov/topics/MCH, and you can find our different information on the block grant itself and things like that. And then we also have a newsletter where we do drop kind of timelines and occasional information, and then other partner events and things like that. So, and here's my contact information. And now it is a webinar format, but I'd love to open it up to questions. I can go back in the slides or wherever. So, yep.
Thanks, Jason. Does anybody have any questions for Jason? He went over, maybe go back to the strategy slide, because I think maybe that's where people might have some input. But again, just reiterating that there's a meeting coming up where this will be hopefully finalized. Is that right, Jason?
Yeah, so we're going to look to, hopefully we could narrow this down to three. We're looking at, just to be more realistic. It's the first year. We're going to look at how we can make these happen. We'd love to, just because you write it down, you got to make it happen. So we want to be realistic and maybe get it down to three. And so it could look like putting a strategy under a strategy, or shaping it somehow that would be relevant and realistic, and within the capacity of us and our partners. So yeah. Any questions? I see some people I've definitely met with maybe mentioned this too, and I don't know if this was clarifying more or not, but yeah.
Yeah, go ahead, Christy.
Thank you, Jason. This is a great overview. So as you guys are thinking about, you had a slide earlier kind of in ways that you will support this initiative, about access, plan, fund, and evaluate. Um, do you see a lot of the focus being on DOH programs implementing and supporting food efficiencies or other like both DOH and other community organizations across the state?
Yeah, and it can look, it could, I don't think that there are too many. So within DOH, we kind of look at what in terms of nutrition and supporting that is going on. I think that we're definitely a partner with WIC, but they have their own funding streams and things like that. But I think externally is more of where we're looking at. There's not necessarily there's not a whole lot going on within some of those strategies. So when we look at these kind of roles of helping plan and things, I think that we're gonna definitely look externally too. I'm already in conversation with SDSU Extension to talk a little bit about that nutrition education piece. I
Hmm.
know that that's kind of their wheelhouse, and so if there's other partners, I definitely want to talk to um, about how we can support this. But yes, we're keeping an open line to anything. I think in terms of our who we're partnering with, how are we gonna execute this? So hope that answers your question.
Yes, thank you.
Hey Jason, this is Carolyn from WIC.
Oh, hey, Carolyn.
Um, I actually was just curious. I know that we're talking about the child domain right now, but
Yep.
when we talk about partnering with WIC, I know you guys have possibly other focuses for women and infants, but is it possible that this program touches more than just children necessarily?
Absolutely. Well, the great thing about maternal child health is it's so interconnected. The health of the mother is, the child is dependent on the health of the mother or the family unit as well. And so Laurel, who's the infant and women coordinator, she's going to be focusing more on postpartum visits, but if there couldn't be some aspect of nutrition education in terms of understanding, the mother as we're looking at that 0 to age, or is it 1 to age 11, I think is maybe the metric. There's absolutely a through line, a theme throughout where we can work across the domains in some regards to affect change in this, especially if WIC does a really good job. They know, you can't, the child's nutrition access is very dependent on the parents and or guardian's ability to access food. And so you can't really affect change in child without going through supporting, mothers and families in some way. So I think there is a through line, and I'd love to talk through that more. But hi, Lacey. I hope does that answer your question, Carolyn?
Yes, thank you.
Okay. Yep. Hi, Lacey. How you doing?
Hi, I'm good. Thanks for this information. It's making me think about a lot of the things that we talked about recently. And as I'm thinking about our programs and initiatives where we are addressing food insufficiency, what does what does the DOH need from us, or like how do we partner, or what does it look like for us to work together to help to achieve this and for you to meet your reporting needs?
Yeah, that's a great question. I think that one thing we're up against is we've never selected this priority before. So what does this look like? That's like the greatest, how are we going to approach this? But I think that whether it's direct working with you guys, I could support your thing, or I'll probably try to have a work group where we can talk through the intricacies and the logistics of some of these things. And that'll be open to people who are able to support some of that. And so I think that it could look quite a few different ways. And why I wanted to support or talk through this on the Healthy Nutrition Collaborative is that could be another, a starting point to mesh over the food sufficiency conversation. Because I know that through some of your initiatives, you focus on all kinds of, child-related things, and most people do. There's not too many people who are solely focused on food sufficiency, but I would say that as long as we just continue to, you know, actively collaborate, I'm kind of looking more towards like plan together, work together on some of these things, I think that it would be that would be more a better way to go than, we can meet and do some things. So I would like to have kind of a group put together. But again, we're up against never having this dynamic before. I am the first person to actually solely focus on child health. There's another context piece. So this position wasn't here prior to me, and really to focus on some of these initiatives. And so, yeah, I'd like to explore those dynamics with you, Lacey. So.
Thank you.
Great questions. And we have a lot of really great partners on this call today too.
And speaking of that, if there are partners that you feel are statewide in scope, or even that I should hear about, definitely let me know. Still building out partner lists and things that, again, within the context of Title V maternal child health, this hasn't really been approached before, and other states have done it. So there's some great examples out there of how we can collaborate and work together. But yeah, there's other people you have in mind, definitely let me know.
Jason, what do you think? Last call for questions?
Yeah, let's get one last round here.
Okay.
Anybody else?
Final questions for Jason? Okay. Well, thank you, Jason. I don't think I actually introduced you with your title, but I think you did let us know you are the child domain coordinator for the Maternal Child Health Block Grant. And we're so grateful that you were the first program to kick us off on this informational webinar series. For folks on this call, we will be offering this to you as well as a member of the South Dakota Healthy Nutrition Collaborative. So if you'd like to do informational webinars, again, we will record this and send it out. So please, we have a large listserv, and I'm sure others would love to hear about your programs. So with that, I think we can close. Any other thoughts for the good of the order before we head out? Okay. Well, thanks for joining us during your lunch. It's fast, it's quick, informational, and we really appreciate your time. So thanks again.